Our big concern is that for some of those critical patients, it could mean longer transport times to definitive care.
Maine EMS says CMMC will soon be considered a trauma system hospital, still capable of providing effective trauma care. But its director says the hospital will no longer be considered the best choice for patients with life-threatening injuries.
But if I'm one of those patients, hearing that I may be further from definitive care is concerning.
I think it's really sad and not good for the city, and just not good. Like, for if somebody had a critical injury, that they would need to be transported like a half an hour away.
The medical director of CMMC's emergency department says she understands those concerns, but she tells me they will still offer the same round-the-clock care for critical patients as they do now, just without the trauma center designation.
We'll still have all the ER doctors, the surgeons, the ICU doctors, the orthopedic doctors to take care of patients who are acutely injured in our community. So the certification is going away, but the capacity to care for the patients is not.
Dr. Clark says instead of paying $500,000 to recertify, that money will be put into patient care. The night of the Lewiston shooting, it was all hands on deck at CMMC, caring for people who'd been shot. The husband of one of the victims told us as a trauma center, CMMC saved lives. Dr. Clark says it still will.
And if we don't have the ability to care for them, then we transfer them. For example, Central Maine doesn't have neurosurgery. So if you have a severe head injury, today you would be transferred to another institution. That will continue to be the case on December 1st.
Maine EMS says which hospitals patients end up will depend on its trauma triage protocol. They say patients with emergency needs like a heart attack, stroke, or an airway obstruction should still be transported to the closest appropriate hospital.